This is the best ACL rehab exercise you could possibly do. And if you're not doing it, you're missing out on important gains in stability, strength and muscle growth. And in this video, I'm going to explain why you should do it, why it's the best exercise ever, and when you should be able to do it safely. But before I do that, if you're going through ACL rehab at the minute and you want to know if you're along the right lines on your recovery, you can head over to my ACL timeline calculator, which will generate you a fully personalised ACL recovery timeline. So you input your surgery date, your injury date, whatever date you've got, and it will show you where you should be at what point through your rehab. Back to the exercise. So this exercise is a bit of a combination between two. We've got step downs or heel taps, whatever you want to call it, where you stand on your injured leg, you slightly lower, tap on the floor, don't put your weight forwards, and then step back up again. And after a couple of those, you'll help them really work in the quad, especially towards the knee. So the VMO, which is the teardrop muscle on the inside of the knee, that's the muscle that's most active at the end of extension, so when you're in this kind of range here. And the other exercise they kind of combined with is the terminal knee extension. So that's working the same sort of movement, but at the end of extension, so that range there, with a bit of resistance added through this band. So combining the two, you're adding a bit of resistance to the step down exercise, and you're also getting that terminal knee extension to work the VMO, the other quad muscles, stability, and a few other bits, which we'll go through in a minute. So why do I like this exercise so much? Although it's a relatively simple exercise, it's actually got quite a lot of benefits. It helps proprioception or knee stability. So when your knee's wobbling, that's really targeting the ligaments in the knee, which helps stability. So with the ACL being a ligament, that's obviously something we're working on here. So by improving stability, you strengthen that ligament itself. You're also helping with extension. So regaining full extension is a priority in the first 2 weeks of ACL rehab. And we work really hard in them first 2 weeks to regain extension. So we want to maintain it and improve the strength and the muscles that help that movement happen. It also helps with eccentric strength. So that's adding load to the movement as the muscles lengthen. So you might think doing a press up as you press is the concentric movement. The eccentric part is when you're lowering. And that's really important when it comes to stability and strength. It also heavily loads the quad. So with the center of gravity moving slightly forward as you're moving down, that loads the quad muscles. So the VMO being the main one that's targeting is the teardrop muscle on the inside of the knee. But any quad loading is really good in the early stages of ACL rehab, where you've probably lost quite a lot of muscle strength, muscle mass, and we're constantly fighting that throughout rehab. So we want to build it up, improve strength, increase muscle mass, and ultimately improve function, which will again help extension or help maintain extension. And another thing with the VMO is that it's proven to help patella tracking. So the patella is obviously the kneecap at the front of your knee, and that moves inside a groove as your knee bends and extends. And sometimes that can be slightly off center. So it could be due to hypermobility. You could have had additional traumas when you did the injury. You could have had a graft from the area. So that could potentially be weak. And if this patella isn't moving nicely in that groove like it should be, then that's going to cause inflammation to the structure underneath and pain. So that VMO, the muscle on the inside of your leg, which sits around here somewhere, just helps keep that in the right place. So it helps with patella tracking, the movement in the groove. So targeting that muscle, as well as all the other benefits that I've explained, can be really beneficial, especially at the early stages of rehab, where everything's a little bit weaker and you need as much strength and hypertrophy as you can get. Well, how do you do the exercise? Let me talk you through it. So for this exercise, you'll need a step of some sort. You'll need some sort of anchoring point, which could be a door handle or a squat rack, as I'm using here. And you'll need some kind of resistance band. Now that will vary in different colors and different strengths. But to start with, use one that's light while you get used to the movement, because it's quite a challenging movement, although it looks obviously fairly simple. And then you can build up from a light one to something a little stronger. So then to set it up, you just anchor the resistance band to whatever you're anchoring it to. Wrap it around your knee, so it's behind your knee pulling away. Stand on your box. Stand on the injured leg, or the leg you want to work. And then, like I said, slowly lower down, trying to keep everything in alignment, so making sure your knee doesn't cave in or out. Stand on one leg, raise your other one, down and just tap the floor below, lowering down really slowly, concentrating on the lowering part of the exercise. Tap the heel below, don't take your weight off it, literally just tap down and then back up again, keeping everything nice and straight as you did before. So if you're at a stage in your rehab where you can do an exercise like that and you can load the knee without pain and without obviously risking any further damage or anything, then give it a go. Let me know in the comments below how you found it. If you're currently going through ACL rehab and you're struggling with support, you're not really sure if you're at the right stage of where you should be. If you're pushing it too much, if you're not pushing hard enough and you just want a bit of extra support, then I've got a step-by-step rehab program that tells you exactly what to do week by week, gives you exercises for different levels throughout your recovery, and then each stage has targets to meet, and once you've met them, you move on to the next level. And if that sounds good, you can learn a bit more about that or sign up in the link in the description below. And if you're also going through ACL rehab and you're not sure if your knee mobility is where it should be for the stage in your recovery that you're at, then this video might be of interest to you. Thanks for watching.